हाँ जी, Bismillahirrahmanirrahim. Welcome to session number 4 of the summer research internship by Spire. And today we are going to learn how to do literature search, how to build a background for your project. We have already made the research question. I have reviewed the research question with you. Then we have made objectives from that research question and we tried our best to make smart objectives. And after that, we derived the title of research from the research question itself, as well as the methodology that we will be employing to do that research. What kind of a research design will be employed. We also derived that from the research question. So, Alhamdulillah, that document was sent in your WhatsApp group. Everybody must have seen that document. And I am going to show you, it's going to be a live search. If you watch my YouTube videos, there is a session, a Research 101 by itself. I think session 3 or session 4 is about literature search. And literature search is, I think, the first critical step after making the research question. Once you have made the research question, you have done maybe 30% of the job. You have a title, you have smart objectives, you already know what research design you are going to be using to answer your research question. The next important step is once you have done the final analysis and you know that your research question is feasible, it's interesting, it's novel, it's even ethical, and it is relevant to the existing body of knowledge, and it is relevant to your work and everybody else's work. You want to see what is already done on the research question or similar to the research question that you have made. So that is background building. That is showing, that is seeing, what kind of knowledge already exists about the question that you have asked. And that is extremely important, because this is where you begin compiling your introduction to the article and you begin compiling the reference part. Okay, so scientific paper, like a scientific publication, has a title, it has an abstract, it has introduction, then it has materials and methods, then it has results, and then it has the discussion part. So you already have the title, you have the smart objectives, you already know what methodology you are going to use. So the material and method part has already started. Like when you write that present study is a cross-sectional or is a case control or is a comparative study, that means that you've already started writing that methodology part of your research. Then introduction, and its introduction is not supposed to be more than 300 words. An entire abstract is 250 words. An introduction is not supposed to be more than 300 words. The thing about introduction is that when we are introducing our topic, we have to refer to the existing body of knowledge. What is already known about our research, and why are we doing that research? Although people have done it before, why are we doing it? So we are going to be defending our project in our research, and we are going to be telling our readers, why is it important that I do this project, that I study whether medical students are not sleeping well because of academic stress, or that I study that people have difficulty answering questions if they are of a personal nature, or if the people have suffered a trauma, like, some of the questions that we have. So that is your introduction part. Now, let's begin with questions. Ask me questions. I'm going to give 5 minutes for questions. So go ahead, either type or speak, but ask me questions. Okay, I see that three interns are not here. They are missing. So I'm just going to write the names because I don't want people missing sessions. These are important sessions. So I'm just going to write their names. Write your names, whoever is here, and you can ask me questions. Okay, who is Dell? Mr. Dell, can you please write your name? Who is Dell? Because Dell is a computer system. I think it's the first time you're attending the session on a laptop. And I'm noting questions, so I will answer inshallah. Iman, Fatma. So all the girls are here. Good girls. Fazlullah, Ibrahim, Memuna. Lareb is not here, I see. Shadman. All right. Hmm. Let me just see the questions. It is said cross-sectional study is the weakest of all. Yes, yes, Shadman. Cross-sectional study is a weak design because we cannot prove a causal association. Remember what I told you yesterday, that if you want to, when you ask why does this happen? How is this associated? That you cannot prove in a cross-sectional study because you're just looking at one cross-section in time. Um, and that's okay. That's still okay. Um, uh, Research has to start somewhere. So even if it's a cross-sectional design, even if it is a survey, you are opening the door for further better research. If no knowledge exists about an issue and you do a little survey, and then you come up with a background knowledge that other people can use to do researches on a better design about the same question. So that is where your cross-sectional design is very important. Yeah, okay. So Dell is Hira. Welcome, Hira. I think we are missing four people, or we are missing three people, I think. Good. Who else has joined? Um, Shadman Mem. Isha. Yeah, okay. Okay, so I think we are just missing one. Yeah, I know. I got your name, Ganwa. No problem. Okay, Ji. So I'm going to go to the document that we were discussing yesterday. I'm going to make up a dummy project, just, like off the top of my head, something that I can demonstrate a literature search for you. Uh, okay. All right. So here is the document that we were doing yesterday and that I corrected for you and I sent all the details here. Somebody asked me that they sent a survey, they sent a study about robotic surgery and that, I should correct it. I'm sorry, I did not get to it. That is why deadlines are so important. That is why, we have to, because see, that is how I plan. This is internship, and I feel responsible. I try to give judicious most time, and the time when I'm most fresh and active to this part of my day. I want to be really active and involved, and I don't want you guys to feel that you wasted time, because this is precious time. But please try and stay within the deadlines, because that is how my entire schedule is planned. If I'm not working with you, once this session is over, I have, like, I don't know, maybe 30, 40 certificates to design and send, because people are working in Spire projects. And so I have to do all that as well. And when one of you submits something later than the deadline, it's really hard getting to it. And फिर वो चीज लटक जाती है, फिर वो delay हो जाती है. So anyway, let me just make up a dummy project here. All right. So the first thing was, what is the research question? And let me just write, what is the aha, okay. So I had a question yesterday and I told the person that I'm going to get back to you. Remember, there was a question about diarrhea. So I think I'm going to do that because that was a very general question. It's a very general question, and I don't think that person will be able to follow it. And it's already there. Let me just see differential something. Causes of diarrhea. Okay. So, what are the causes of diarrhea among children under 5 years of age in Pakistan, right? So I'm going to go to, let me just go back. Yeah, I'm going to stop the share here and then go to Google and show you how to do an actual search. Okay, so I'm going to go here and I'm going to go to my. All right, so somebody broke down in tears, too sad. Um, all right. Now, remember the question? I'll just write what was in the question. This is the simplest way of doing literature search. It gets complicated, but this is what you need to learn today. Causes of diarrhea in children under 5 in Pakistan. ठीक है? See, Google just, explodes into this amazing, amazing information bank. And I'll even tell you other search engines besides Google. But anyway, so month of April and May, 2,000 children are affected. The data is coming from somewhere. I don't know from where. Contaminated water. So a cause is contaminated water. April, May, more than 100 children, poor, poor personal hygiene. March, May, more than 100 food and waterborne. So this is an information that is coming from something, okay? The next article that we find is the rise of diarrheal disease in the children of Pakistan. So lo and behold, we have we have the perfect article. Okay. But also Google has this. See, Google has questions that people ask and it saves the questions and saves the answers as well. See, what causes diarrhea in children under 5? Da dee da dee blah dee blah, everything. Okay. But I'm very interested in an original article that I found, The Rise of Diarrheal Disease in Children of Pakistan. So I open it. And what I see here, ye dekho, this is a PubMed Central, PMC. This is from the National Library of Medicine in Washington. Okay. National Center for Biotechnology Information. This is a very, very big project by the National Library of Medicine in United States. And it has, I don't know, millions and millions of articles. Okay. What we say that this is PubMed index. Remember, आपके teachers भी कहते होंगे, you have to publish in PubMed index. ये वो PubMed है. PubMed is public medical library. And PubMed Central is a separate project that is focused on giving you full text articles. पूरे पूरे articles होते हैं इसमें. It doesn't, PubMed by itself, if you go only to PubMed, it will only give you the abstract. And usually you have to buy the article. PubMed Central is a project that full text. See, PubMed Central full text archive. So you have full articles with full information. You can get a PDF of that article. Now here is Health Sciences Reports is a journal which is open access. It can be accessed by anyone. Most of the articles in PubMed Central are open access. They have to be open access. They're not copyrighted. Okay. So Health Sciences Reports in 2023 January, this article was published. Okay. Now, how do we know whether this article is useful for us? The rise of diarrheal illness in the children of Pakistan amidst COVID-19. So I don't know how important this is. I really don't know. COVID-19 एक तो बच्चों को होता भी है, doesn't do anything to them. But this group, whichever group this is, has studied a difference in diarrheal disease in children of Pakistan, and they are probably less than 5 years of age after the COVID-19 pandemic. And this is a narrative review. This is not an actual research. It's a narrative review, which means that many researches were done, and these authors have compiled those researches here for you to give you to tell you whether there is a rise of diarrheal illness in children during the COVID-19 pandemic. See, you have to read every line. Hmm. The problem is it's not the access. The problem is not the access. Problem is knowing how to read and what to read and how to know whether an article is useful for you. Okay, so let's see where the article comes from. Zainab Sayyida Rahmat is from Dow University of Health Sciences. So the study is coming from Karachi. The principal investigator or the first author, the second author is coming from Dow University. The third author is coming from Jinnah Sindh Medical University, Sindh Medical, which is SMC. Then is Dow, and then is Kabul. So maybe the student was doing an elective there and because it's not a doctor. Anyway, then is the background. And they've given a good background. In Pakistan, 74 out of 1,000 children lose their lives. This is the under 5 mortality. ठीक है, हम झूठ बताते हैं WHO को, हमने ये 50 something की हुई है, हमने बड़ी कम की हुई है. No, 74 out of 1,000 children lose their lives annually, which means 7.4% of our children are dying before 5 years of age. This commentary addresses the contributing agri bloody blah sara. The narrative review has emphasized the causes of the spike in pediatric diarrheal illness. फिर results हैं provision of safe drinking water, proper use of integrated management of IMNCI, adequate awareness of benefits of breastfeeding, use of correct rehydration such as oral rehydration, and the crucial implementation of EPI vaccination schedule, जिसमें rotavirus भी है, can curb this increase in diarrheal cases. ये इनका abstract है. ठीक है, पढ़ लिया आपने. अब आगे आप introduction पे आ जाए. This is the important part. And we will write an introduction, but I don't want you to write an introduction like this one. You know, शुरू से ऐसी नहीं होती है introduction. शुरू में introduction आप खुद लिखते हैं. You write the introduction in your own words, like you're writing a story. And once you write a 300-word story, out of that, you pick statements that are claims. See what they are saying. Diarrhea is defined as loose watery stool that occurred 3 or more times per day. It is a definition of diarrhea. This is the first reference, definition of diarrhea. So once you write the entire narrative, once you write that story without looking at references, no looking at references, no copy pasting, no downloading, no nakal maring, and no plagiarism. You just write it in your own words in good English. After that, जब introduction में कहीं पे भी if you have made a claim, जैसे मैं ये कहूँ कि this is the definition of diarrhea, while in research I cannot make up a definition of diarrhea. I have to give a reference. Okay. It can be categorized as acute, persistent, or chronic. Again, reference. Okay. Acute diarrhea can be divided watery, bloody, both caused by different pathogens, Vibrio and Campylobacter. Reference. Okay. Diarrhea is a common occurrence. And it is considered normal for young infants to have 3 to 10 loose stools daily. Again, reference. I'm not making any statements or any claims just because I think so. That is anti research. It is not what I think, it is what evidence shows. So, the first thing I want you to do today is to get out of this mindset. And unfortunately, all of us are exposed to this mindset during rounds, during discussions, during lectures. Our teachers speak without evidence. You know, our teachers will say, by our teachers, I mean, because I am a teacher as well. So I'm telling you my experience with teachers. We will say, when I was in United States, this is what we did. Well, when I was in United States, that was maybe 1,000 years ago, and so much research was not done. And I was treating children in United States. I was not treating children in Pakistan. And I have no evidence that those techniques also work for children in Pakistan. So my statement is extremely illiterate and my statement is not qualified. I have to qualify my statement. I will say, if I'm teaching you and I say, when I was in Pakistan, when I was in United States, this is what we did, but I found that when I came to Pakistan, this thing worked better. Mhm. And it was also investigated by WHO or Aga Khan or somebody, and I give you evidence that although in America or England people are doing this, but evidence shows that Pakistani children will respond to this. That is something else. So, this is the importance of evidence, and this is what I want you to internalize today. Let me just see. So, it shouldn't start with reference, the introduction. Nahi beta, exactly. That's a very good question. You are doing a background search to get into the mindset of an investigator. आपने रिसर्च क्वेश्चन बना लिया, स्मार्ट ऑब्जेक्टिव्स लिख लिए, टाइटल लिख लिया, आपने उसका methodology bana li. Then you say, okay, I really like this. So now I'm going to do a literature search. I like my topic. It's a good question. Dr. Afshan has made it all green and she said, this is very good and this is doable. So now I'm going to do a background search. So you do a background search and you read, 3, 4, 5 good articles about your topic. The way I'm reading, you read those articles like this. Then you shut down that window and then you write your own introduction in your own words without looking at the references, in your own words. And we will do this exercise today. I'll show you. Okay. After that, after you write that story, 300 words, you after that, you insert references in your story. That is the sequence of preparing a publishable manuscript. Okay. Okay. So now we are proceeding in the introduction. Worldwide, see, first they said that Pakistan mein kya hota hai. Okay. Then worldwide, 1 in 9 child deaths are due to diarrheal illness. So they are now saying that diarrhea is not only a problem in Pakistan, it's a problem the world over. It's a big problem. And then they are quoting, see, global killer. So he's quoting a good article that came out it was accessed. I don't know when it was published, but it's there. It's there in the references. And then, it's a contributor to the malnutrition in children. And again, he gives an article that came out in an international journal, Nutrition 2021, and he gives a reference. So whatever he is saying, sorry, he's qualifying it. Okay. Now the good thing about PubMed Central is, see, I just, I did it, so I'll show it to you. It will take you to the reference. 8. See, and where it says PMC free article, you can actually open that article. You can, or you can, you have full text. So you can actually open that article and read it yourself. Okay. Let me just go back to the introduction. Okay. Then he does WHO has ranked 23 in terms of mortality. No, we are very poor. 6.5 million of diarrhea cases of diarrhea. Diarrheal case have been on the rise throughout the country. 2,000 children in the city of Lahore in just 1 month time. See, so he has a reference for this. But he has written an introduction and he has inserted references where he has or she has made claims. So that is how you go about writing an introduction. And today we are going to just focus on the introduction. Okay, Pakistan, see here, one way to curb this increase in diarrheal disease, especially in children, is to establish educational programs throughout schools in Pakistan to enlighten the public about health safety and blah, 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 blah. And then reference number 18. Okay, now let me just show you something. The effect of education based on health belief model and promoting preventive behaviors in hypertensive disease. I don't know why he put it here, but yeah, he did put it here because it is related to health education. It's not a good reference, but anyway, the writer probably didn't find a better reference, so they put it here. Worldwide, almost 88% of deaths associated are linked to the use of unsafe water, amongst other causes. Okay, so he's qualifying his statement. Another leading contributor to diarrhea among infants is the lack of proper breastfeeding. Now, this is a completely new uh, subject. Babies who are breastfed are proven to have stronger immune systems and less diarrhea episodes and gastroenteritis, also known as stomach flu. Benefits of breastfeeding. और ये आया है Cleveland Clinic से. So again, it's a good reference. It's a good strong reference. So this is it. I'm going to stop here. I'm going to give you a 5 minutes break. We will come back at 7:35. So we will come back at 7:45, inshallah. Okay. And then I will write an introduction in front of you according to the objectives in the question that we selected. And I will show you how to insert references in that article. Okay. I will stop screen share here. I don't have any questions. Yep, I don't. If you think of any questions, just type them in the chat box and rejoin at 7:45. Are we done with literature search? No, I'm going to show you how to insert references according to the introduction that you write. So we're going to come back at 7:45. And then I'm going to show you, I'm going to write an introduction in front of you and then insert references in that. Okay? Okay.